Good morning and welcome to Health Dialogues, Bridging the Voices with Mamelo. Universal immunization of children against common preventable disease is crucial in reducing infant mortality and morbidity according to World Health Organization. In Lesotho, routine childhood vaccines include BCG, OPV, IPF, measles and rubella, and PCV, and this is according to Lesotho Demographic Health Survey of 2023 to 2024. According to Lesotho Demographic Health Survey of 2023 to 2024, 57% of children aged 12 to 23 months and 54 of those aged 24 to 35 months received all basic vaccination by appropriate age. Looking at the trends in childhood vaccination in Lesotho, the percentages of children aged 12 to 23 months who received all basic vaccination decreased from 68% in 2004 to 62% in 2009, then rebounded to 68% in 2014, and then fell to 63% in 23 and 2024. Meanwhile, the percentage of unvaccinated children dropped from a high of 3% in 2009 to less than 1% in 2023 to 2024. Looking at the background characteristics, the percentages of children who received all basic antigens is higher in urban areas by 68% than in rural areas with 60%. Today we'll be having a discussion with a nurse midwife who has worked in one of the clinics in the rural areas of Lesotho for 4 years to discuss the gaps in immunization and the improvements and a way forward in this particular program. Can you introduce yourself and your background in nursing?
I am Mamelo Mutlo. I am a professional nurse with over 5 years of experience working with organizations that help me work with a wide range of patients. I am interested in introducing detailed nursing care plans through interdisciplinary collaboration. I demonstrate expertise in physical, psychosocial development, and educational aspects of nursing care to all the clients. Thank you.
What motivated you to work in the immunization programs in Lesotho? Was there a particular moment or experience that shaped that path?
After being selected to be an EPI focal person in my facility, which is an expanded program in immunization, I became drawn to immunization, and I believe that every individual deserves access to life-saving vaccines. And with the passion I have for this immunization program, with the passion I have for this immunization program and for community health, I am excited to be contributing in improving immunization coverages and eliminating vaccine preventable diseases in my community.
What are the most common vaccines administered in Lesotho immunization schedule?
Okay, we have about 6 or 7 vaccines that we normally encourage mothers or caregivers to ensure that their children are vaccinated. We have the BCG one that children get at birth, and the oral polio vaccine, which we administer orally. We also have the type that we administer it intramuscular to prevent those preventable vaccine diseases. We have the measles and rubella vaccine, which is the most common one because we normally have outbreaks for measles or rubella. So we find that in most cases, we hold campaigns for that vaccine. There's quite a variety of vaccines, but I've noticed that in me being in this field, measles rubella is the most common one that is being administered or vaccinated.
How has the vaccine coverage changed over the past years in Lesotho? Are there any areas where you have seen gaps or challenges or any progress? Are there any differences between the rural and urban areas?
I would love to start with this one of the differences. in most cases, you find that the population we serve in urban areas and communities, it's a bit different in terms of their understanding, ability to like their literacy and all sorts of that. So we found that in urban areas, the population understands better than here in rural areas. So the coverage is a bit higher in urban areas than in rural areas. Coming to the differences, I think I can't really say there is a huge improvement in coverage. The coverage is fluctuating depending maybe on the factors that could affect the immunization. Sometimes you find that this year the population understands or gets the importance of getting vaccinations. Sometimes the following year they're forgotten, or maybe they don't understand anymore. Why should we vaccinate and stuff? So I can't really say there's an improvement or there's a decrease in the coverage. The coverage are fluctuating, varying from year to year.
What challenges do you face in reaching all the children, especially in hard to reach areas or underserved communities?
Okay, thank you. The most challenge that I get here in rural areas is that the setting of our facility, or the terrain, how our facility is placed. The facility is very far from the villages. Like, people have to walk hours and hours to get to the facility, and most of our clients, they have to cross rivers to reach the facility. So during the rainy seasons, it becomes hard for them to come to the facility, even though they are willing to come and get their children vaccinated. They try to come and the rivers are full. They have no way out, no horses, nothing. Even if we ourselves at the facility, we try to go there at the community to like conduct outreaches, we are unable to cross to the other side because we just can't, due to the rivers overflowing. The other challenge is that even those that are far but they don't need to cross rivers, they need to use taxis, and some of them don't have funds to like for transport fare. So it becomes very hard. During winter, our main challenge is snow. Snow is very common in our area. So you find that sometimes you've given them the return days or the follow-up dates to come for vaccinations, and they're unable to come because that week or that day snow has fallen in, and it takes weeks and weeks for it to melt. So it's really, really a challenge for us. Another one is, despite the weather and the distance, is that most of our clients, they work out of the country, so they leave their babies with grandparents, and sometimes you find they left a child, they didn't even give the grandparent information or the bukana on what vaccines the child got. So it becomes very hard for us to trace and find out about the immunization status of the child. Thank you.
How do stigma, misinformation, and cultural beliefs affect the vaccine uptake in the communities that you serve?
In this community, culture is considered very much. So you find that the cultural taboos and misconceptions about vaccines, they do really lead to the reduced uptake or the coverage of vaccines, especially vaccines such as the HPV vaccine, because it's associated with the sexual health. So people around, they understand, if we say we want to vaccinate your child with HPV, still explaining that it's just to prevent, they think we are labeling their children as sexually active girls or something, because they say if it's associated with sexual health, why are you even vaccinating my child while she's very young? How do you even know she's sexually active? So such misconceptions or such things, they are the ones that cause the reduction of the uptake. And the historical trauma and the mistrust of healthcare systems. Like, if you could recall, there was a time measles rubella was vaccinated some years back in Lesotho, and it had very not very good side effects. So people are now scared. Whenever we're trying to come to them and introducing the measles rubella campaign, they're like, like what if it causes what it did last times. So those are such of things that causes the reduction of the coverage. One other thing that I've realized is social media has a very huge impact in our communities. So you find that there is a lot of misinformation that is going around the social media, which sometimes overrides the reliable sources about the vaccines. So people rely much on social media. So that makes people not become eager to get vaccinations. Thank you.
What role do mobile clinics and community health workers play in ensuring that children get vaccinated?
The mobile clinics have a very positive impact in making sure that children are vaccinated, because with mobile clinics, we are able to go to the communities. So we are able to go to the communities, whereby we are able to reach all that children that were unable to get to the facility due to lack of transport and all that those factors. And for us to get that children, the community health workers play a very huge and important role, because it is through them or their help that they're able to pass messages and let the caregivers to gather at a selected point or vaccination site. So with their help and them mobilizing, it becomes easier for us to get all the children that didn't make it to the facilities. So they really play a important role in this immunization.
What keeps you motivated to work in these communities, especially in resource limited settings?
I think I've realized the impact this immunization does to the community. Uh, despite being in rural areas, despite the challenges that we are facing, but there is still a positive impact that I see in communities. The likes of since there's immunization programs have been introduced, there is reduced rate of diseases outbreaks that this immunization are preventing. Also, knowing that immunization is part of saving lives, and I've been motivated to keep going, because I know that despite the challenges or despite the fact that I'm in rural areas, these immunizations are contributing in saving lives. So that keeps me motivated to keep working. And working with dedicated healthcare workers, I think it has also given me motivation, because as a team, if we work hand in hand, we are able to achieve what we want, and that still makes a positive impact to the community and lives are saved. So that gives us a very that it's not just about the community or giving out services. It also gives me personal growth as an individual, and it improves my skills. So that makes me keep being motivated.
If you could design the ideal immunization program, what would it include? It could be more training, better data systems, or something else.
Okay, if I was to design an ideal immunization program, I think it would involve a very comprehensive training. It's not just to healthcare workers, but even to community leaders, community health workers, like everyone, mobilizers that help us in mobilizing. Because I think if one is well informed and understands the importance of a program, they will be able to disseminate information to the community, and that will help us with increasing more coverage, as the community will be understanding the importance of this immunization program. I would also make sure that I invent an advanced data management system, like for tracking vaccination records, for monitoring data, so that it can help us in planning and making improvements. Because working without data, without recording, without tracking, it's as if you've done nothing. So having advanced systems that are helping us to track the data and be able to see our performance, help us do some improvements where there's need, the advanced data management system would be helping. I think I would also consider community engagement, because this service delivery, it's two-way. It's not just about us health workers providing the services to the community. Like I've said earlier, the community has to understand, why are we getting these services? What benefit are we going to get? What important? So engaging them in planning, educational strategies, and everything is going to help us achieve that higher coverage that we want. And also, I think also making vaccine services are accessible. Like for such people that for hard to reach places, we can plan outreach sessions. We can add more vaccine sites. Like for instance, if we were used to going to 1 or 2 villages, we can extend to other villages so that all the community gets access to the services. Also, maybe we can extend the working hours at the facility so that every person is able to access the services. Also, I can also make sure that there is vaccine supply chain management, and by ensuring that there is a reliable and efficient supply of the commodities, so that there's never a time the community has to suffer because maybe there are no resources and things like that.
What gives you hope for the future of immunizations in Lesotho?
What gives me hope is the way our government is committed. As much as there may be hiccups or challenges here and there, but our government is working very hard and shows dedication in this immunization program by interacting or partnering with huge organizations such as WHO, UNICEF, and the likes. So that gives me hope that going forward, they still be able to achieve that coverage that we want. Also, increased access for the immunization is giving me hope, because there are campaigns held whereby we follow up the zero dose immunizations. Like that, these children, you'll find that this child has been born, she's 2 months, 3 months, but she or he did not get even a single dose of a vaccine. So through the government, we get support and we're able to go to the communities to find that children. Also, I think the way the community is engaged, it gives me hope, because as we engage the community more, they are able to get.
You have been listening to Health Dialogues, Bridging the Voices with Mamello. Remember, every voice matters, and together we can make healthcare accessible to everyone. Stay connected, and I will catch you on the next episode.